Good afternoon. Uh, I am Dr. Jil Garala, Senior Resident in Ophthalmology in Siusha Medical College from Gujarat. I'll be presenting study of the digital eye strain due to extensive digital device use among the UG medical students in tertiary care teaching hospital. Technology has transformed every realm of our lives in the information age, from healthcare to education, prompt communication, extensive availability of the information, and going paperless or go green are the various advantages. However, every action comes with its opposite reaction, and the digital revolution is no exemption from this rule. Digital eye strain includes a group of ocular and vision related problems attributed to prolonged use of the desktop, laptops, mobile phones, tablets, and screen. Its pathophysiology is multifocal with several contributing factors being reduced contrast level of the lighters compared to background digital screens, glaring, reflections, wrong distance and angle of viewing the digital screens, poor lighting conditions, and infrequent blinking of the lights. The condition can cause various symptoms like eye strain, watering, headache, tired eyes, burning sensation, redness, irritation, dryness, foreign body sensation, blurring vision at the near, and diplopia. Online learning services served as a remedy during the pandemic. There was a rise in usage of internet services from 40 to almost 100% compared to the pre-lockdown levels. Being restricted indoors, digital devices became the only source of entertainment. Ultimately, this has resulted in an upsurge in the symptoms of digital eye strain among the most individuals, irrespective of age, sex, race, or region. There was a cross-sectional study was conducted among randomly selected 100 UG medical students of Siosha Medical College in Surendranagar using a pre-designed questionnaire into the digital device use pattern, symptoms of the digital eye strain experienced by them. Those who experienced one or more symptoms related to the digital device use were considered to have DS. Data collected was entered in the Excel sheet and analyzed. Descriptive statistics was expressed as frequency and percentage. Chi-square and Fisher's exact tests were applied accordingly. In results, the study indicated 80% prevalence of DS among the students, of which the prevalence among the female and male were 37% and 63% respectively. 84% students were using devices held less than 1.5 feet from the eyes. The digital device preference among the students was maximum 56% for smartphones, 24% for laptops or computer, and 20% for notepad or iPad. 71% students were using devices for more than 3 hours per day. This is the table which includes the various symptoms, in which 11% symptoms of moderate severity was watering, and highest was headache with 15% of moderate severity, whereas severe symptoms are less compared to the other symptoms. So factors associated with digital eye strain, duration of use, preferred device, and distance from the eyes, in which 39% of students were using 3 to 5 hours, 32% students for more than 5 hours, 23% students were using laptops, and 56% were smartphones. Majority of the students held the devices 1 to 1.5 feet, like 54%. This is the female and male distribution, in which 22% of the male use 3 to 5 hours, and total 33% use for 3 to 5 hours. And discussion in prevalence in present study, 80% students stated experiencing the symptoms of DS. The prevalence of DS is ranged from 53 to 73% in several other studies, which includes the mean age of 22.5 years and male predominance 63%. In symptoms in present study, 55% had burning sensation, 53% had itching, 60% had watering, 58% had headache, 49% had pain and heaviness. Several other studies also reported watering and headache as the most common or disturbing symptom following the usage of digital devices. While there are challenges in determining the prevalence of DES, levels of 50% or more have been reported in numerous published studies. Now, conclusion: usage of digital devices for work and social purposes, often for many hours each day, is now normal among individuals of all ages. Digital device use of more than 4 hours per day, underlying refractive errors, and prior dry eyes are the most significant risk factors. So, digital device use in myriad form ranging from smartphones to laptops lead to high prevalence, and due to inappropriate practices and like inappropriate distance from digital screen and inappropriate duration of use. Thank you.
Any questions from the audience? Okay. So did you do any type of cycloplegic refraction in your patients,
Yes, sir.
doctor?
In every patient.
In every patient?
Yes, sir.
So what were your findings?
Mostly were refraction was present, like they were already myopic, most of the patients, but there was some increased level of myopias after the duration of 1 year, at the end of 1 year, because they are still my students at there. So I am continuously calling them yearly and some 6 monthly. So there is significant increase in
Progression
numbers.
of
Yes, sir.
myopia.
Definitely
was
progressed. Yes, sir.
Okay. So this digital eye strain, what could be the main leading cause for the digital eye strain? Is it dry eye, or is it strain of the eyes, or is it a change in the refraction, or there is any imbalance on the
Most students are complaining of using devices for longer time for the day. That is the direct cause I have found in my studies. Other causes are risk factors rather than directly associated during this study.
So did you try to find out the reason by assessing any accommodation by AC by A ratio or any other parameter?
No, sir, but I am still trying. I am continuing my study to the next level. So.
Okay. So take up another study
with
the similar topic.
Definitely.
Yeah.
I am still continuing this.
Yeah. Thank you.
Thank you, sir.